Hi, Roy here, and I want to spend just a couple of minutes here talking about some of the fundamental differences between traditional medicine and functional medicine. And our clinic is a functional medicine clinic, and traditional medicine as a whole tends to focus on making the diagnosis and then moving towards treatment and addressing the symptoms. And the way our system works in this country is you have a problem, you go to the doctor, nurse practitioner, they do their questions of you, their examinations, then they perform the labs or x-rays, CAT scans, and what they're trying to do is come up with a diagnosis. What do you have? And attach that diagnosis to what's called an ICD-10. It's a code, and once they have that code, they are now allowed to put you on a medication or to refer you to surgery. The problem with that approach is the medications really don't heal anything. What they do is they suppress the symptoms. And a good example is diabetes. People have diabetes, the blood sugars are high, so the docs put them on metformin, glipizide, insulin, any of the other medications, and the sugars come down. The trouble with that approach is you still have diabetes even though you're taking that medicine. Your sugars may be normal. And you got to take that medicine basically every day or every week, because if you don't, the sugars go back up. Functional medicine, we try to address what's causing the problem. And we address what's causing the problem. When you do that, the problem goes away. Kind of like if your phone, somebody's calling you and it makes that obnoxious ringing noise, and it's going to keep ringing until you answer it. And once you answer it, the ringing stops. The example I like to give is if you get a splinter in your leg and you go to traditional medicine and they say, does it hurt? You say, well, yeah, it does hurt. They say, okay, here's you some pain medicine. Oh, it looks kind of red. Let me give you an antibiotic. You come to the functional medicine person, we say, let's just get rid of that splinter. And we do that, you won't need the pain medicine, you won't need the antibiotic. And again, going back to that example of diabetes, we know majority of the adults with diabetes have it because it's type 2 diabetes. They have what's called insulin resistance. There's things we can do in our clinic to get down that insulin resistance so that the sugars come down naturally, and we have people in my clinic, other functional medicine clinics, coming in on 2, 3, 4 diabetes medicines and working with us 2, 3, 4 months. The A1C is down to normal. Traditional medicine likes your A1C if you're an adult between 6 and 7. We want that A1C in functional medicine below 5.7. We want it normal, because when it's down at that normal range, guess what? You don't have diabetes anymore. Now, if you go out and do the things you're doing beforehand, yes, the diabetes will come back. But if you stay doing what we have taught you to do, the sugars stay down and you don't need the diabetes medicines. Same thing happens with a lot of autoimmune issues, depression, hypertension, heart disease. And so, again, functional medicine is we go back and we treat why you're feeling bad. And when we treat the why, the problem tends to go away. Not always, but most times it does tend to go away. So that's a big difference. Do we need traditional medicine? Well, yes. If you look at this COVID crisis going on right now, we need all those acute medicines for the people in the ICUs. But it's not the answer to everybody's problem. And that's part of the problem, is we have all these people being put on medications, and it's bringing down the symptoms, but it's not making people healthy, not making people well. And this is, again, where we're getting in trouble with this COVID crisis. What we need to do is address the diabetes, address the heart disease, address the autoimmune issues, and get people healthier, because what we're seeing with this COVID crisis is the ones who do badly, the ones who die, have these comorbid problems, diabetes, hypertension, heart disease. So thank you for paying attention and staying with me, and I look forward to talking to you in the near future. Thank you. Bye.